what do we think?
Yeah.
Broads, is that kind of what you see more on the heart failure
Mhm.
front in the emerge?
Yeah, definitely. Yeah, a lot of that. I think what's interesting is you can get both difficulty breathing and shortness of breath while walking around. Again, because you're not able to keep up with that kind of oxygen demand, the blood kind of pumping that you need. But yeah, there's a lot of that. Patients feel worse when they're lying down, or what you might see is incrementally over the course of a couple of days or weeks. They're having difficulty often sleeping at night because they tend to maybe lie flat initially. That's really hard to do. So they prop themselves up with one pillow. Then maybe it's two pillows. Now maybe they're sleeping on the chair in the living room because they can't lie flat. Because, as the fluid redistributes around the lung, it kind of gets harder when you're flat. The fluid takes up more of the potential space of the lung than when people are upright.
So then other ways that you can see fluid buildup, and this is another common one, is it goes into the lungs. It kind of goes back through the right side of the heart, and it backs up into the rest of the body. Because of gravity, the legs are where you tend to see it first. So you'll get what we call edema. That just means fluid buildup. So you get fluid buildup in the legs, and it's this thing called pitting edema. And all pitting means is if you stick a thumb and you push really hard on your swollen legs and it leaves an indent, that means it's pitting. And there's a few things in medicine that cause that, but heart failure is kind of one of the first things that we think of.